Okay, well, let's get started with our presentations from countries. Let's start with Ukraine. It's my pleasure to introduce Dr. Maryna Aleksandrova and Dr. Hanna Prykhodko. Dr. Aleksandrova is a specialist in the management of viral hepatitis and opioid dependency in the Department of Public Health Center of the Ministry of Health of Ukraine. She has 13 years of experience in molecular diagnostics and virology, and she's responsible for the coordination of the national program in Ukraine. We're very happy to have her. Please.
Thank you. Hello, everyone. I want to express my sincere gratitude on behalf of our entire team for the opportunity to participate in such an event and to discuss the current situation on viral hepatitis in Ukraine. This is extremely important to us, especially during this challenging period for Ukraine. Russian wars against Ukraine has been lasting for more than 10 years now. The war started February 20, 2014, when Russia invaded and annexed Crimea and partly to east regions for Ukraine. Before dawn on February 21st, 22, Russia launched a full-scale invasion across Ukraine from multiple directions using land, sea, and air. By sunset, Russian special forces and airborne soldiers had seized the nuclear site of Chernobyl after a bloody battle and were advancing into the outskirts of the Ukraine capital, Kyiv. Ukraine is successfully fighting against the enemy. Intense battles are happening in a lot of cities and regions of our country. We, however, know that we are protecting our land, our relatives, and the future of our children. More than 22 million of people were forced to leave their homes and began seeking shelter in safe areas in the country. There are 8 million of refugees from Ukraine across Europe. The Ukraine healthcare system also faces obstacles. Many healthcare workers were forced to abandon their jobs and evacuate from dangerous areas. A number of healthcare institutions were relocated. Many Ukrainian doctors had to seek jobs abroad. The military aggression of the Russian Federation resulted in a big number of human casualties, migration within and beyond the country's border, and all of these factors are directly reflected on the country's population. From recent events, the shocking crime of the Russian army is bombing of the Prykhodko hydroelectric power plant in the south of Ukraine, resulting in the flooding of vast areas of nearby land, populated villages, and the city of Kherson, which will have huge ecological and social consequences not only for Ukraine but for the entire world in the future. Ukraine faced 5 months of active attacks on the country's energy infrastructure, which created a significant risk of blackout. Despite that, we continue to move forward. So what kind of problems our aggressive neighbor left behind? Occupation of certain regions and territories, difficulties in the logistics of drugs, medicines, and other supplies within regions, damage or destroyed healthcare facilities, here and after HCFs, medical workers fleeing to other regions and countries while others facing overwhelming amount of work and cannot physically cope with it. Disease spread as a result of limited access to medicine and discontinuation in the treatment of chronic diseases. A number of HCVs were damaged, of which more than 118 were completely destroyed and cannot be restored. Also worth noting that Ukraine suffered significant economic losses because of the war. Despite the difficulties caused by the war, it is important to note that the Ukrainian government is taking measures to improve its healthcare system. After the full-scale invasion of the territory of Ukraine by Russia, one of the main challenges is to restore the medical infrastructure and ensure access to high-quality medical care. Despite all the challenges over the war, Ukraine is already implementing country's recovery plan. We want medical care to be high quality, accessible, and of course free. There is a great deal of work to be done on the deoccupied territories. Needless to say, the mental health of all people, both civilian and military, was also traumatized. However, with the support of the country's First Lady, programs related to the management of the mental health are developing rapidly in Ukraine these days. And by 2023, more than 100 tasks are placed at track of digitalization. The implementation of the medical information system, monitoring of socially significant diseases is being implemented successfully, and telemedicine is being implemented as well. And now let's dive deep in HCV program itself in Ukraine. In 2019, the Cabinet of Ministers of Ukraine approved the state strategy of HIV infections, AIDS, tuberculosis, and viral hepatitis elimination by 2030. The country strategy corresponds with the WHO's. According to the strategy, 90% of new cases should be prevented. Up to 90% of infected individuals will be aware of their status, and 90% of HIV patients will receive medical care and treatment. To determine the number of patients who should be tested and treated each year, the CDA in 2018 calculated elimination scenarios for the country. Our objectives are presented on the slide, and currently we can see that we are significantly behind the implementation of the goals, and therefore they need to be revised, and the deadline for achieving the goals of elimination needs to be postponed. According to estimated data, 5% of the population in Ukraine is infected with HCV, of which 3.6% have a chronic disease, and 1.5% of population is infected with HBV. Biobehavioral studies are conducted for key groups every 2 years, and the results are used to estimate the prevalence of HCV in this population group. The prevalence among donors is regularly collected, and the PHC has an entire unit dedicated to this matter. However, it's not available publicly since the war. In the country, mass screening for HIV markers among prisoners was also conducted. 30% of the 22,000 individuals tested and have positive results. The number of people who tested for HBV and HCV hepatitis markers is presented on the slide. After 2020, we can clearly see a decrease in the number of people tested for HBV markers because of COVID-19, which followed immediately by the war. We have data regarding HIV testing, but it fails to accurately represent the situation. The slide illustrates the gap between the number of people tested positive for HIV markers and the number of confirmed cases, as well as the expected number of confirmed cases. Thus, we lost a significant number of patients during the diagnostics phase. Currently, the country's HIV monitoring system cannot conclude the exact annual number of HIV-related deaths. On death records, the cause of death is listed such as hepatocellular carcinoma, HCC, or cirrhosis of the liver, but its etiology is not specified. To obtain enough data about death rate from HIV, the PHC with WHO have conducted a cross-sectional study. The results are presented on the screen. 8.5 thousand people die from HIV every year. According to the data obtained on the slide on the right, we can see that the number of deaths from HIV and TB is significantly lower than from HIV, which corresponds to the global trend of decreasing mortality from TB, HIV, and malaria, while mortality from HIV is only increasing. Next slide. Thank you. Among the advantages of the diagnostic in the country, first of all, screening for HIV with a rapid test is included in the list of services provided by family doctors and also included in 11 package of the program of medical guarantees. In 2022, for the first time, rapid tests were procured with state budget funds. Limitation includes the following. There is no separate PMG package for HIV, lack of free confirming diagnostic. Most patients have to pay on their own. Therefore, there are patient losses. The graph shows a decline in testing across the country. Absence of standard laboratory, absence of an electronic system with all diagnostics results. Currently, free vaccination is available only for children in Ukraine. Vaccination is suggested for the other groups of people as well, but at their own cost. In Ukraine, HPV vaccination of infants began after the year 2000. We can see that throughout the year, the numbers of children who get vaccination decreased due to anti-vaccination campaign and the pandemic of COVID-19. In addition, Ukraine's vaccination rate was reduced by the full-scale invasion. Thus, the need for vaccination of the adult population against HIV and HBV of military personnel, medical workers, and representatives of services involved in providing assistance to the country population has become critical. In 2019, the government of Ukraine began funding a harm reduction program in the country. Because of current budget deficit, the Global Fund took over responsibility for funding the program services. Yet, we wait for a return of state fundings. And please pay attention to HCV prevalence among key groups on the right. So when it comes to harm reduction program, we all understand that prevention programs are the same for preventing HIV and hepatitis. But we see that the efforts for HIV are not enough because the prevalence of hepatitis is still increasing. When we are looking at harm reduction programs, we should mention about opioid substitution therapy as one of the most effective preventive programs for HIV and hepatitis. In the context of hepatitis elimination, it is worth mentioning that OST program was implemented in Ukraine in 2004. Since then, the program has achieved significant results and it's considered one of the largest programs in the Eastern Europe and Central Asia regions. The main achievements are mentioned on the screen, among which drugs are procured with state budget funds. We also have progressive policies including standards of treatment, 95% patients receiving RT, etc. What should be noted is that the treatment can be provided by any trained doctor. Also, a number of training courses has been rising. Moreover, ambitious objectives are set for ST implementation, even though we are currently facing Russian aggression. What kind of challenges we have to face when the war began? Just to name a few. Difficulties with the logistics of OST medicine, risk associated with the lack of the OST drug, difficulties with the arrival of patients, medical workers. National drug manufacturers stopped working. Since OST is prohibited in Russia, OST program had to be stopped on occupied territories. Migration of OST patients. Despite the tremendous number of challenges, Ukraine managed to overcome most of it. So what has been done? Orders were implemented allowing to take home medicine for 30 days. Another order allowed to store 3 months supplies of drugs in healthcare facilities. A new OST drug was received as humanitarian aid called Buvidal. There have been steps taken to support the mental health of OST physicians and patients. A pilot project on video monitoring of the self-administration of OST drugs was launched, from procurement of drug supplies from the national manufacturers. All the actions resulted in the expansion of the program, which is fantastic. As February 1st, 2023, we had 25,000+ OST patients and had accomplished 110% of its initial goals, which is undoubtedly successful. In Ukraine, the system of infection control or prevention wasn't set up until 2018. In the last 2 years, a number of infection control measures aimed at enhancing infection control and prevention antibiotic resistance were implemented. So what are the necessary steps to achieve the goals? It is digitalization, data management and accumulation of strategic data, accessible testing, optimized patient routes and simplified approaches to diagnostics and treatment, accessible medicines and also developed infrastructure of healthcare facilities. Among the achievements are the following. A large-scale decentralization of viral hepatitis treatment services has been carried out. The image shows the progress of the situation from the start of decentralization before a full-scale invasion and throughout the war. In some regions, the number of institutions may be decreasing, but in frontline areas where active hostilities are occurring, HIV continues to be treated among both the civilian population and the military, despite all of the challenges and difficulties. In addition, the number of healthcare facilities where patients can receive treatment are restored and expanded. In 2021, new modern standards of care for HCV and HBV were approved. The key aspects are used of the most simplified diagnostics and treatment methods, and the right to prescribe and carry out treatment can be given by any doctors, not just an infectionist. Currently, the standards of care are being reviewed and amended in accordance with the latest international guidelines and standards of care. Regarding the treatment of HCV, we are currently observing a significant rise in HCV treatment coverage, which is mainly due to decentralization and the availability of generic medicines of viral hepatitis in Ukraine. The coverage situation for HBV treatment is worse, unfortunately. In Ukraine, generic medications are used for the treatment of HCV with the exception of the 3G regimen. However, the manufacturer has reported that this medicine has been removed from production, leaving Aleksandrova as the only available alternative. The declared cost per course for Ukraine is $16,000. This is extremely expensive, thus a major dilemma for the country, as the national budget cannot cover it. Therefore, we will be unable to treat a specific category of patients. To ensure transparency and to make services of the treatment of HIV fully accessible, digital tools have been implemented, such as chatbot. Also, information about drug residues in the regions is posted on the PHC website, and there is a map indicated health centers where rapid tests can be handed out. Among our key achievements, you can see information campaign, new online courses, pilot projects, and etc. Due to the difficulty in providing medical assistance in some areas, the risk of HCV and HBV infection increased. Not always is it possible to provide this assistance using every available infection control approach. A little bit about increased risk of HIV infection. Currently, it is challenging to figure out the scale of the consequences after attack of Kakhovka Dam. However, what we do know is that the problem of HIV and other infectious diseases is serious. Unfortunately, in Ukraine, vaccination against HIV is not included on the list of required immunizations, resulting in a low vaccination rate. Due to migration, the risk of HBV and HCV spread in Europe is increasing. On the basis of our population estimated prevalence for HCV, we can conclude that approximately 400,000 HCV-infected individuals and 120,000 HBV-infected individuals migrated to Europe. I would like to add that the majority of them may be unaware of their condition and therefore may not seek medical assistance. The majority of the tremendous obstacles created by the war are being solved. We have done continuum of decentralization, logistics of drug between regions. The program of viral hepatitis is still financed by the state budget. Expansion of HCV treatment among key groups in narcological clinics. Expansion of OST program during the war. Changes in standards of care for viral hepatitis. To conclude, while there is a number of activities that we have already managed to successfully implement, we still need to work hard. Our top objectives are listed on the screen, and it is ensuring the availability of expensive drugs for the treatment of HCV, screening strategy and free diagnostics, studying the potential of self-testing, telemedicine for the treatment of HIV, adjust elimination scenarios and update data for decision-making, initiatives and activities aimed at elimination for HIV among military. Thank you for your attention. If you will have additional question, I will gladly respond with my colleague Anna Prykhodko.
One of the limitations you mentioned was the lack of a good data system to collect information about the number of tests. But it seemed like you had some good data regarding the number of persons being tested. So what's your current system? How do you currently collect data regarding the number of persons tested and treated for hepatitis C?
The main data source is for us is just communication with the departments and regional departments of healthcare. So we get the data from them. Now we are currently developing the model that will be implemented to the medical informational system. It is electronic system, and we are forecasting that the managing of the data in electronic way will be more available for us. Now it's just like a handing. Thank you.
Questions? Any other?
Because as I imagine, it's very hard to know on the records if a person can be retested, for instance, on the data you present. Because I fully agree, it's quite a big number. I mean, it's great work considering the situation you have in the country.
Thank you for your question. It's a good question, and we also are thinking about this problem because we have no electronic system for checking all results of diagnostics, and it's area and that's problems we try to discuss and.
is a gap. It is a gap right now. Yes, we understand it, but we will try to improve it, and we are working on it right now, because we know it is challenging very much, because we are not quite sure that the data is available and be presented. Thank you.
The other area that, in thinking of prevention of HCV among people who inject drugs, you did mention the access to clean injection equipment for people who inject drugs, and I'm asking, was there any disruption in the supply of that, or the community groups that probably helped you distribute those clean injection equipment to people who inject drugs? Has there been any changes in that part of harm reduction?
Yes, the main we are working with our partners, non-governmental organization, as well as partners in regions. So I guess they have a very good and very big part in this. So non-governmental organizations in regions, so they also controlling these harm reduction programs, as well as supplies chain and procurements for that. Thank you.
Do you have any evidence that the number of people who inject drugs are increasing or decreasing because of some of the mental health issues and some of the other issues that you raised?
So the number of people is increasing. Sorry, yeah.
Yes, Sanai.
Thank you, Dr. Ward. Sen and Hanna, CDC. So question about blood products and blood safety. Do you have any data on testing blood products? I assume there is a huge need because of all of the fighting that is going on. So any data from that, and also any challenges of testing blood products currently in Ukraine?
Thank you for the question. We are working only on prevention and harm reduction and viral hepatitis. So we had also other departments. It is cross-cutting them. So to be more clear, we need to discuss it and to clarify with our colleagues. And after that, we can tell you.
Yes, and however, is not available publicly since the war. We cannot share the number of this.
Marcelo from WHO Europe. Senad, it's with the Ministry of Defense, the blood safety data. So they're not allowed to disclose. We had partners like Médecins Sans Frontières, Paris, trying to work with the group in Odessa, and they found the same obstacle. But the country office, we can definitely connect and get something working.
Thank you very much. You can come back around for a discussion later in the program. Thank you.